Hey, what's up, everybody? You may have heard of Wegovy or Ozempic or Mounjaro, also known as semaglutide, and then Mounjaro is also known as tirzepatide. These medications were recently developed over the past couple years and are very effective for type 2 diabetics, but they also are extremely effective at weight loss. And so at this point, they've been used so much for weight loss because they're so effective that they're becoming hard to come by. People are getting on these medications, and the next month they are unavailable. And so all the weight that they lost, they gain it all back, and then it's like a roller coaster ride, right? And so I wanted to tell you guys about other medications that are out there that are very effective at weight loss that people don't even know about. My name is Michael Ward. I'm a nurse practitioner, ICU intensivist, and I'm also the owner of nextleveltrt.com. We're a performance medicine practice who we historically have been only online, but I actually just recently opened up a local space just south of Fort Worth. And so I prescribe weight loss medications all the time, right? All the time. And I've had a lot of success with semaglutide and tirzepatide with my patients. But again, it's getting increasingly difficult to come by. And I can use compounding pharmacies, which I do. And but even still, even though they bring the cost of the medication down, some of these compounding pharmacies still are having trouble getting supply. And some compounding pharmacies are getting raw ingredients that aren't exactly the correct formulation to make these drugs. And so I wanted to make you guys aware of some other options. So one option would be Qsymia. Qsymia is a weight loss medication that's composed of two different drugs, phentermine and topiramate. Right? So phentermine is a stimulant medication, suppresses your appetite and increases your metabolism. And topiramate is an anticonvulsive medication. Now these two medications, because they're combined, they synergistically work, and you have much lower doses of these two medications than you would if you were to take each one independent of each other. And because of that, you can take them for longer periods of time, and you don't have the side effects that you see at those higher doses. So you can still have some things with any drug that you take. You're going to have a potential for adverse effects, but the most common adverse effects with these medications, this medication, Qsymia, is dry mouth. You can have a difficulty falling asleep if you take it too late in the day. You can have nervousness because it's a stimulant medication. You can also get dehydrated because it actually causes you to forget about eating, and because you forget about eating, you can also forget about drinking, right? So you can get dehydrated, dry mouth. You can taste food a little different, dysgeusia. It can cause food to taste a little nasty. And so these are the most common. You can have some GI effects. And it's been shown over time with phentermine use, you can have aortic valve defects. So it's something you don't want to take for a long period of time. But it certainly is a great medication, but some people just don't like the stimulant effect of medications. These are great medications, and I've used successfully in my patients, Qsymia. But one in particular that I'd like to talk about that hardly anybody knows of is AOD 9604. AOD meaning anti-obesity drug, 9604. It's an FDA-approved peptide that causes your body to be more efficient at burning fat. And the way it works is it stimulates your pituitary gland to boost your metabolism. And it also causes lipolysis, which is the breakdown of fats, and it inhibits lipogenesis, right? And that is the creation of fat. And so it's really, really effective, especially at targeting areas that have higher concentrations of fat, like your midsection. It has a very, very safe side effect profile. As a matter of fact, there's not any health risks that they've noticed that are associated with this particular peptide. which is amazing, right? Because there's very few medications out there that do give you no side effects, right? Well, this one particularly has been shown to have no side effects. So it's pretty awesome. Also, it has some other effects. It helps regulate blood glucose and insulin. And it also has some effect on musculature. It can cause muscle hypertrophy. So it's really cool. AOD 9604. The way that you take this is injectable, right? So you take it every day in the morning, 30 minutes before you eat breakfast. And it's going to cause you throughout the day to just burn fat, and prevent from forming fat. And so it's really, really great option. AOD 9604 is a peptide that you can get from any provider that can prescribe this medication. Again, it is an FDA-approved peptide, and you can get these from compounding pharmacies. Now, there are ways that you can get AOD 9604 online. I never recommend buying peptides online because no matter what these places say, whatever their websites say, these are prescribed peptides. These are prescribed agents. And whenever you buy something online, you really never know what you're getting, right? I mean, there may be some great labs out there that make this stuff, but you're injecting this stuff and it's risky, right? I mean, you have to have a sterile compounding facility to make these. And it costs a lot of money to create a space that's good for sterile compounding. And it's just very unlikely. Whenever you buy things online, even on the vial, it says not for human consumption, for research purposes only. So it's risky. So I'm just saying, I would recommend, if you're going to do this, find a provider in your space, in your area, that provides or prescribes peptides. And the best way to do that would be to call a compounding pharmacy or Google search compounding pharmacy in your area and then ask them if they have peptides. If they do, find out who's prescribing peptides in that area, and then they can direct you to somebody that can help you. That would be my best suggestion. Anyway, so I hope this helps. I have created a peptide booklet, right? I call it the peptide guide. And in it, it gives the most common prescribed peptides, what they're used for, how they work, dosing instructions, the benefits and the risks, like any kind of side effects that may be noted. And it's in my bio. Just click the link in my bio. It's a stand store. And it's free. I just created it because so many people have so many questions about peptides. And that's kind of like one of my things. I prescribe a lot of peptides for a lot of my patients. If you are in Texas and you want to talk with me about peptides or weight loss or even hormone treatment, I do testosterone replacement therapy. Feel free to reach out. Also in my stand store, there's a link that you can reach out to me. And I do free consultations online, or you can visit me in Fort Worth, locally. We can draw labs. We do all that stuff in the clinic, and we can get you taken care of. All right. I appreciate you guys. Mike's out.